to think about when we think about breast cancer is screening, breast cancer screening. And if you Google breast cancer screening recommendations, there are a lot of rabbit holes that you can fall down because there's a lot of different recommendations that are out there. And it seems like there's sort of no consistency. And so I'll explain to you kind of what the purpose of that was and then what I think is a reasonable approach. So the idea is that there's no such thing as a one-size-fits-all for screening, right? There are some patients who are at high risk and who need to be screened more often, and there are some people who are low risk and don't need to be screened as often. And the same idea of screening based on risk can apply to mammograms. And so whereas we used to recommend kind of a blanket, everybody needs a screening mammogram starting at the age of 40, that's the idea behind some of these nuances of the screening recommendations. That's where it's coming from. That instead of kind of a blanket recommendation that everybody be screened starting at the age of 40, that maybe we don't have to screen every single patient starting at the age of 40. And that instead we should look at the individual patient and see like what is their actual risk of developing a breast cancer, and then screen patients based on their risk. So I'll be honest with you, I in the world that I live in, am not real comfortable identifying someone as being at very low risk of developing a breast cancer, because most of the people who I take care of have no known risk factors for developing breast cancer. And so their disease was found on a routine screening image that was performed regardless of their risk. Generally though, the recommendation remains an annual screening mammogram starting at the age of 40, unless you fall into one of those brackets. And so most of the mammogram units in Knoxville, not just at the breast center, although all of the breast centers who do mammograms do 3D mammograms, including the mobile unit that comes around, they also do 3D mammograms. But most of the places around town have also adopted that technology as it's sort of the standard of care at this point. But the cool thing about a 3D mammogram, it actually shows you different layers of the breast. So instead of getting a single picture, you get multiple pictures through the layers of the breast. So the 3D mammogram can help look through those different layers and tell us, is what we're looking at sort of an overlapping dense breast tissue, or is it really a mass that's there? So the cool thing about a 3D mammogram is that it increases the sort of sensitivity of the test. It picks up more cancers, but the really cool thing about it is that it decreases the callback rate. Speaking of dense breast tissue, there was a law passed several years ago that requires your mammogram report to have a comment on the bottom about whether you have dense breast tissue or not. So if you've had a mammogram in the past probably 20 years, it's now on there. You have dense breast tissue. You're like, my gosh, what does that even mean? So there's 4 different breast density categories that we recognize. And again, I'll sort of back into what they are. So category number 1 is patients who really don't have much dense breast tissue whatsoever. It's called a fatty replaced breast. Those patients really don't need a 3D mammogram. They probably don't need any additional screening whatsoever. On the other end of things is what we call an extremely dense breast pattern, which if you are old enough to remember on the antenna TV, you remember back in the day, the antenna TV, if you turned it on a non-channel, it would look kind of like that snow. People my age and older are like, yeah. The young people are like, it's okay. An extremely dense mammogram looks like that snow. You really can't see anything in that mammogram. In between that, you either have heterogeneously dense breast tissue, which is a little more dense, or you have scattered dense tissue, which is a little less dense. A lot of that is kind of in the eye of the beholder, and by that I mean the radiologist who looks at it. And sometimes the radiologist will comment one way or the other whether it's scattered or heterogeneously dense breast tissue. Most of the time also when you go through menopause, your breast density tends to get lower, so you can see maybe that a little bit of that walking through and kind of decreasing in density as you get older. The hard thing about whether you have heterogeneously dense or especially if you have extremely dense breast tissue it can become very difficult to find a cancer. Because if you're looking through the snow, sometimes you feel like you're looking at those pictures. You remember those pictures that were popular at one point? They looked like nothing, but if you stared at them long enough, like something would start. I could never see those, by the way. I thought that ain't right. But sometimes when you're reading an extremely dense mammogram, you kind of stare at it and you're like waiting for something to come out at you because you really can't see anything. And so those mammograms make all of us pretty nervous. Because there actually is data to suggest that you're more likely to get a breast cancer if you have extremely dense breast tissue, and it's harder to find. So you sort of already have two strikes against you. So sometimes if you have, especially if you have an extremely dense breast, we actually offer additional screening on top of the mammogram, which a lot of times will come in the form of an ultrasound that you can have done.